So, Patrick, welcome back. I wanted to just take a moment here. I've seen you, I think, 2 times. We initiated DTR, but I wanted to give you an opportunity just to kind of tell your story a little bit about, what you were diagnosed with, what you tried, and then ultimately how you ended up here.
Okay. So I was diagnosed with trigeminal neuralgia in October 2024. I tried every pain medication available, right? That never worked. Then I started on carbamazepine. That found relief partly. Then I had to up my carbamazepine a couple times. Then the symptoms were so bad. I just was so foggy that I switched to oxcarbazepine. That was a little bit better. I did every dietary thing you can do. So I take B12 every day. I quit caffeine, chocolate, bananas, citrus, spicy foods, hot foods, cold foods. I think I already said caffeine. Quit everything I could that was supposed to make it worse. And then got on the internet and was looking up, MVD surgery, Botox, all the different things you can do for it. And that's how I came across your page. Found you on the internet, listened to testimonials. The real selling point for me, obviously, as you know, is that I was 10,000 miles away when I got this. And I found out that you were 8 miles away from my hometown. And so I was just like, it's meant to be.
Sure.
And so that's why I got set up here. We've done 2 sessions. After the first, we did the consultation session and then like the full session. I had a little bit of pain, as we've discussed. I had like 3 days of pain immediately after. And that was, what did we do? I think we did in March 27th.
Yep.
Because I left March 28th. So March 28th, 29th. So basically all of April, all of May, the last, 2 months and 1 week, I've been pain-free, which is longer than any spell of pain-freeness I've had since then. As we discussed, it used to be, anywhere from like 11 to 12, 8 to 12 weeks of pain, and then I would get maybe 2, maybe 3 weeks of without pain. And now I've had 2 months without pain.
Okay.
Sorry, that was a long story.
No, that's okay. No. It's not long at all. I think as somebody watching this for the first time and maybe hearing about this would be like, what did Sutter do and what did Patrick endure as far as a treatment goes? Because usually it's either the medication or it's the surgeries, right? And like, I'm a dentist, but I didn't even get you numb. Like we did all of this. The changes were so small that it didn't require you to get numb, not like doing a filling or something of that nature, right?
Yeah.
But you said something to me because, Deb was working on some insurance stuff for you from the Peace Corps, I think. Mm-hmm. And then you came in the office to see her for a minute. And I asked you, because I just happened to be up at the front, like, hey, how are things going? You remember what you said?
Mm-hmm. I said it was life-changing.
Life-changing.
Yeah.
People don't really coincide life-changing things with trigeminal neuralgia, especially in a dental office. So what about, the obvious thing is you don't hurt like you did before, but like, is there anything that sticks out in your mind that makes it life-changing?
Yeah. When you get this diagnosis, your whole world kind of flips, right?
Mm-hmm.
I read a thing that said like, because I guess it's a disease, technically. It says like some diseases take your life, some diseases take over your life. And this is one of the ones that takes over your life. It's the only thing you can think about. It's on your mind constantly. All you worry about is, where's my medication? Am I going to be in pain this meal? Am I going to be in pain tonight? Am I going to be in pain tomorrow? When I came back from the Peace Corps, my plan was not to come to Eugene. My plan was to be in Washington. I was going to be in grad school. I was going to do all of these things that I wanted to do with my life.
Yeah.
And then in a blink of an eye, my entire world was flipped upside down. I had to move here. I had to move back with my parents. I didn't feel the freedom that I could do anything with my life. I didn't feel like I could basically go anywhere because all I had to do was doctor's appointments. I couldn't work for a couple months because I didn't know if I could even hold a job because I was in pain. I didn't know if I'd ever be able to have a job. I didn't know if I could ever do any things I like to do, play sports, anything. Basically, I thought my life was over. It's kind of how my life.
And you're young.
Yeah, I'm 27 years old as of last month.
Happy birthday.
Thanks. So yeah, I basically thought my life was over. And now for the first time, I'm starting to think that maybe it's not. And that maybe it's going to be okay.
Isn't that crazy?
Yeah.
Good for you, man.
Thank you.
Good for you.
Yep.
Well, I appreciate you sharing your story. A lot of these, no, it's all good, man. It's all good. It's overwhelming when you have a spot of hope after been down the road and the thoughts that you've had and you've entertained. It gives a lot of hope to, I think, other patients, which are thinking the same things you are, and not by the hundreds, but by the thousands.
Yeah.
Right. And so, that doesn't mean I have everybody's answer, but if you got 2 months being pain free and all I did was get your bite right, and the alternative is you're on the medications, but you're practically a zombie anyway. You talk about changing your life. If you can't think and you're just existing, you're not even living, right? Mm-hmm. I think the opportunity to have an option that is very conservative, and I mean, this wasn't cheap by any means, but it's not MVD prices. It's not Gamma Knife prices. And if you've been on those forums, you know just as much as I do that a lot of those people have that surgery multiple times.
Yeah.
And some are better, some are the same, and some are worse than they've ever been. And so that's a hell of a gamble, right? You got to be in a real bad space to think that, I'm going to go down that avenue because there's just nothing left, mm-hmm. right? But I appreciate you allowing me to share your video because I think there are so many people that this could be an option for. And while I've had this therapy, not because of TN, because of something else, it's sad. I think the profession of dentistry has a lot of egg on its face as far as what it owes the public. But getting your bite right was something that we should do anyway. I mean, as a dentist, like we're in charge of the bite, right? I mean, so correcting that, and then that's good. And then all of the benefits that you're getting from it, well, that's just a bonus. That's just a bonus of getting the bite right. So we're not done, but I'm confident in the fact that, usually we don't see patients that have had this kind of outcome go into relapse. We just don't see it, right? So when you get to a point where you're like, hey, I've had a couple of months where I'm pain-free, the bite is stabilizing out, but I still need multiple appointments just to follow you, check on you, and check the bite and make sure that things really are stable, okay? Do you have any questions for me about that?
Not really.
Glad you did it?
Yeah. Yeah, incredibly glad I did it.
All right. Well, I'm glad you did too.
Thank you so much. Yeah.
Yeah, thank you.